We are speaking right now with Keir MacDonald. He is the Chief Executive Officer of the Phoenix Society. The Phoenix Society is dedicated to social innovation and community initiatives that help participants exit the cycle of addiction and homelessness. Good evening, Keir. Thank you so much for joining me. How are you?
I'm good. I mean, as you mentioned, it's been a tough day with some of the reported numbers in terms of overdose today. So it's a very relevant segment this evening.
Absolutely. And I mean, as you mentioned, it's another record-setting month for overdose deaths here in BC with 175 deaths in June after a previous high of 171 in May. But as someone working with people struggling with addiction issues, does this surprise you?
No, the results don't surprise me, especially given we had heard reported earlier in the month the record-breaking ambulance calls throughout the month of June. So that was setting things up to be a pretty heartbreaking day today in terms of the release of the coroner's numbers. It's, again, that we've all been hearing about the impacts of the COVID-19 pandemic, and definitely persons using substances have been disproportionately impacted by that crisis.
Mm-hmm. And I mean, how has COVID-19 influenced an increase in overdose deaths?
I think the biggest impact has been really the disruption to services and the disruption to people's safety nets. So really the advice from our provincial health officer has been to looking at isolation, looking at physical distancing, all these things to try and keep people safe from COVID-19. These are exactly the things that we've been, the opposite of the things that have been directed to help people address the other public health emergency. Isolation kills. And, we see record numbers that, 80% of all deaths occurring in private residences. So, the advice for one pandemic, unfortunately, has been, really deadly advice for another. Plus, we've continued to see the record toxicity of the drug supply. So, I mean, the two factors are really combining. One, the impact on the drug supply into the province, leading to a really more contaminated supply for people using substances, and secondly, more people using alone because access to services or access to, again, friends, family, support networks are leading more people indoors than ever.
Mm-hmm. And I also want to ask you, some people are saying that there is a correlation between CERB, so the Canada Emergency Response Benefit, and this increase in overdose deaths. But what do you think about this?
Yeah, I've heard the reports and seen the reports like everyone else. I mean, within our own programs, though, we haven't experienced a lot of impact from that. In a way, people being in residential substance use programs throughout the crisis have been, in a safer, more protected environment. And but again, I have had colleagues and others report that when the CERB payments went out, a lot of people, obviously, that may have chosen to enter recovery or treatment, again, with fresh money on offer, many of them took the money and unfortunately went and used that in other ways.
Right. And I mean, how does this new announcement of new funding that is now being offered by the government into treatment and recovery beds, how does this help the growing issue?
Yeah, I think it's a significant symbolic gesture as well. I mean, we've been seeing so many emergency-based responses and harm reduction responses that really trying to tackle the crisis that it's been. What we're now seeing is some investments in again, treatment and prevention. So to see the first, investment, I think, in a number of years in new treatment and recovery beds, it's part of the solution. We really need investments across all areas, and they're all equally important in that continuum. But treatment and recovery is a significant part of that continuum. We need people to have, an avenue to get well, and to be supported to a healthier lifestyle. And likewise, we need access to harm reduction services. So, the sector was really excited this week to see that last Friday to see that announcement.
Right. And you mentioned this, but with recovery, there is that flip side of it that a lot of people who struggle with addiction do not want to go into recovery and would rather continue using, but of course do so safely. So what about with that? I mean, there are so many people who are dying due to the toxic drug supply and perhaps are not at that step to go into recovery.
Yeah, and that's why having multiple strategies to address people and support them where they're at, whether they're continuing to use substances or they're weak, they're looking to abstain from substances. So, many are calling for things like decriminalisation, for a safer drug supply, for additional harm reduction services. I mean, ultimately, to enter and find your way to treatment or recovery, you have to be alive. And really, this is such an emergency and a crisis that, we're seeing hundreds and thousands of people over the last number of years dying. We've got to keep people alive because, sometimes those windows for a choice of a different path and a different lifestyle are very narrow. And it's so important to have access to that care and access to treatment, detox, more quickly and readily when people make that decision, because without those investments, without those beds available, quite often that window disappears before people can access the help they need.
Yeah, and you mentioned this, but Dr. Bonnie Henry is also one of those people calling on the decriminalization of drugs. Do you think that this would help when it comes to reducing overdose deaths?
Yeah, I think it's another strategy that really significantly needs to be considered because, we talk about combating stigma, and when we talk about even the community of Surrey, there's so much stigma that's carried across different populations, and the criminalisation of substance use is a big part of that, and so decriminalisation, really the non-penalty of people using substances, actually treating it like the health condition that it is, would be a significant step. Redirect some policing and criminal justice resources into treatment and supporting people instead of penalising them. So definitely, I think that those calls, and we've all faithfully followed the advice of Dr. Henry during this latest pandemic. Yet it seems, for whatever reason, despite the fact that she's been calling for this for a couple of years, we've seen a couple of positive announcements over the last week with different levels of government and even the Police Association supporting or at least signalling their support for decriminalisation. So it's, again, we're 5 years into this public health emergency, and unfortunately some of these conversations are coming a little too late.
Absolutely. This isn't a new issue. This has been happening for years here in BC, but it is really being affected greatly due to these dual public health emergencies in the midst of the COVID-19 pandemic as well. But I also want to ask you about hydromorphone as an alternative to illicit drug use. And there are some pilot projects that are trying to increase access to hydromorphone tablets. But what are your thoughts on that?
Look, again, I think any regulated supply that can get people off the harmful substances, so for people using fentanyl and contaminated fentanyl, not knowing how much of a substance is in their dose, switching to something like hydromorphone, it's controlled, it's prescribed, it's still a drug, but it's administered in a safer way, and it's not contaminated. This is a pharmaceutical grade drug. And so, again, it's been a challenge to expand those kind of services. And again, I think we're continuing to see some of the enhancements of those safer supply programs. But I think, again, given the cost of those programs and the amount of effort it takes to scale up those programs, again, I think it's an avenue that's definitely worth pursuing, but it's been very time-consuming to roll out.
And what do you think that the federal government can do right now to support the opioid crisis and the increase in overdose deaths? Do you think that they're doing enough?
Yeah, many people, again, have been looking at the federal government and the lack of even accepting this as, the public health emergency it is, the national health emergency that it is. Even that symbolic gesture and would be significant to recognise, the thousands of lives that have been lost across the country. I think, again, we've seen what it takes when you significantly invest in a recovery like we've seen with the COVID pandemic, when you really turn on all the funding to keep, again, whether it's stimulating the economy or keeping people with money coming into their pockets, what happens when there's a concerted effort to address a public health emergency. I think that, again, the province and the federal government have to be, complimented on the work they've done, but I think it's just highlighted the lack of investment in whether that's funding and resources to really address this other public health emergency.
And the Phoenix Society is one, but is there enough support here in BC in terms of addiction services as well as mental health services?
Look, I think we've been seeing again some great announcements, largely due to COVID-19 again over the last couple of months, in expansion of mental health. There really has not been a system, that has been fractured. There hasn't been enough services or a continuum of care to adequately support people. And I think that, the NDP government has to be, thanked for the work they have done to help build that out. But it's still coming together, and it's still a lot of work that needs to be done. And there are great agencies across the province doing really, really fantastic work. But it's these funding opportunities like the extra, 50 to 70 beds that are going to come online next year that, it's not just the metro areas. I think we see this, impacting most in more of the rural and remote communities that just don't have access to resources like the Phoenix Society provides. So I think if we can, again, continue to see these investments and, to try and get some geographical distribution of those resources, it'll just, again, whether that's mental health or substance use services, I think it will give people greater access to care that they need when they need it.
Yeah, and I also want to give you an opportunity to tell some of our listeners, we are here in Surrey, and the majority of our listeners are from Surrey as well, and the Phoenix Society is located here. So if you could just provide a little bit more information about what exactly the Phoenix Society provides for people who are struggling with some of these issues.
Yeah, thank you. Phoenix Society has been around in Surrey since 1989, so we just celebrated our 30th year anniversary last year. Our main programs really, as you mentioned in the introduction, is supporting people, that are facing barriers related to substance use, mental health, homelessness. So we offer an integrated model and really a really robust model to address, addiction and mental health and homelessness, where we co-locate residential substance use treatment beds with supportive housing. So when people finish treatment, they have somewhere to move forward and live, which is so important as well when, again, 40% of the people we support have no fixed address. So they are otherwise homeless. So they could come into treatment, do really well, finish the program, and then they would have no home to return to.
Right.
So housing is such a key piece, as we continue to hear in the community as well. But then we also layer in on top of those pieces access to employment services, educational services, really trying to provide people with access to that suite of services that they need to get back on their feet. You talk about this community, and again, there's been recent reports from even Fraser Health showing that even the overdose deaths for South Asian people in particular has increased by something like 300% from 2015 to 2018, compared to about 138% for the rest of the population. So there's still so many people that aren't accessing care, aren't accessing service, and I think it's just a great opportunity to continue to promote. There are fantastic services, and we're not the only one in Surrey, and really just to reach out, whether it's to speak to your physician, speak to a counsellor, to get a referral if yourself or someone in your family is experiencing some challenges with substance use. There is help, so on offer.
Absolutely. And I think that is such an important piece as well. And as you mentioned, that report from the Fraser Health that details that South Asian men in particular are most likely to die from overdose deaths. And a big reason from that is because they don't ask for help. They don't ask for treatment. Their families aren't even aware. So that definitely is a big part of getting help and being able to fight this as well. Thank you so much, Keir, for your time, for being here with us on the show. I really appreciate it.
My pleasure. Thanks for having me on.
Thank you. Take care.